How do we determine pregnancy progression or regression? Hello friends and welcome back to my channel. I'm Dr. Olena Berezovska, in case someone has forgotten or is new here. And today we'll discuss determining whether pregnancy is progressing normally or showing signs of regression. We'll explore what indicators to look for, what they mean, and how to recognize when a pregnancy may not develop as expected. We'll also talk about pregnancy hormones, especially ACG, how hormone levels can help us predict or confirm what's happening during early pregnancy. Most miscarriages occur during the first trimester, so our focus will be on early pregnancy loss and the tools we use in those critical first 3 months. An ultrasound can easily show how the baby is developing late in pregnancy, but in the early weeks, it's not always possible to visualize the embryo or detect the heartbeat immediately. That's why understanding the limitations of diagnostic methods is so important when assessing whether a pregnancy is progressing. Many women rush to the doctor when they get a positive test, go for an ultrasound and do lab work, only to become anxious when the expected results aren't there yet. For example, the gestational sac may not be visible or hormone levels may seem too low. And then comes the questions, is it normal? Is the pregnancy progressing? Let's break it down together. As I've explained in many of my videos, especially those on HCG, it is essential to monitor ACG over time. Let me emphasize this again. We must avoid rushing to conclusions in early pregnancy. We need to evaluate the gestational sac, the embryo, and the heartbeat in dynamic observation, not just from a single exam. There are also a widespread myth that a non-developing embryo poisons a woman's body. In reality, an embryo may be only 1-2 millimeters, far too tiny to poison the entire adult female body. Let's leave these myths behind. If you have watched my previous videos, you have seen that ACG is a positive sign. So ACG trends and ultrasound findings help us assess whether the pregnancy progresses. In most cases, if a woman is experiencing symptoms like bleeding, the first test is an ultrasound, not ACG, to rule out ectopic pregnancy or miscarriage. What can we see on ultrasound that raises concerns? Fetal heart rate. A visible heartbeat is a good sign, but if it slows below 85 beats per minute after the 7th week, this may suggest a problem. Size ratios. The gestational sac and embryo ratio should align with expected norms. If the yolk sac is enlarged over 5-6 millimeters or appears deformed, this may indicate an issue. The shape of gestational sac. An irregular shape is something simply due to the ultrasound angle, but if repeated scans confirm it, it could be concern. Bleeding or hematomas. If bleeding is found near where the sac attached to the uterine wall, it might signal detachment. Central hematomas are more concerning than peripheral ones. Let's talk about understanding of ACG in early pregnancy. Usually, ACG doubles approximately 48 hours in early pregnancy, especially during the 4th and 5th weeks. A rise of at least 66% is considered a good sign. However, ACG naturally declines after 9 or 10 weeks. This is normal. So a drop in ACG at that stage doesn't always mean something is wrong. There is also a specialized form of ACG, hyperglycosylated ACG, which showed some promise in predicting pregnancy outcomes in certain miscarriages. However, due to its cost and lack of widespread reliability, it's rarely used in routine care. If in clinical practice, ACG is more of a diagnostic tool than a predictor, a sudden drop in ACG, especially when there is no heartbeat or visible embryo, usually confirms that the pregnancy has stopped developing. ECG is also used in diagnosing ectopic pregnancy or monitoring after a molar pregnancy or specific treatment. All diagnostic tools have limitations. At 4-5 weeks, we may not see the embryo or heartbeat. Most heartbeats are detectable only by the 6 weeks. That's why I always recommend repeating an ultrasound in 7 days unless there are heavy bleeding. We must also always rule out ectopic pregnancy. If the pregnancy is progressing, if the uterus and embryo are growing, then the chances of curing to term are very high. However, if we see growth delays or irregular measurement, this could indicate an abnormal pregnancy, and any attempt to save it would likely be ineffective and unnecessary. So carry your pregnancy with calm and confidence. Trust your body, avoid panic, and remember that not everything has to be perfect from the beginning. Patience and proper follow-up are key. If you found this video helpful, please give it a thumb up, subscribe to the channel, and hit the bell icon so you won't miss new content. Take care. I'll see you in a following video.